Welcome to our comprehensive exploration of dengue hemorrhagic fever. Through the collective efforts of our committed group, we have immersed ourselves in this urgent global health challenge to provide you with this thorough analysis.
And this is our table of content. The first one is definition. Second is sign and symptoms, occurrence, diagnosis, mode of transmission, types of treatment, prevention and control program, and the amazing fact.
What is dengue hemorrhagic fever? So dengue hemorrhagic fever is a severe form of dengue infection that mainly affects children under 10 in endemic regions. It often follows a previous dengue infection and is characterized by an immune system reaction that leads to increased vascular permeability resulting in symptoms such as vascular leakage, bleeding, hemoconcentration, and potentially circulatory collapse known as dengue shock syndrome. So dengue hemorrhagic fever is an acute and life-threatening condition caused by the dengue virus, primarily impacting children under 10 years old in regions where dengue is prevalent. This disease typically occurs in individuals who have previously been infected with the dengue virus. It is distinguished by an aggressive immune response that triggers heightened permeability of blood vessels, leading to a range of distressing symptoms, including internal bleeding, hemoconcentration, or the concentration of red blood cells, and in severe cases, a circulatory collapse known as dengue shock syndrome.
Symptoms and signs of dengue. Hemorrhagic fever. Dengue hemorrhagic fever often begins with abrupt fever and headache and is initially indistinguishable from classic dengue. Warning signs that predict possible progression to severe dengue include: first is abdominal pain and tenderness. Abdominal pain is a serious symptom of dengue. According to research, some cases of dengue fever have been reported where the patients experienced pain in the right side of the abdomen along with excessive vomiting. When the CT scan of the patient's abdomen was done, the rectus sheath hematoma was confirmed. Rectus sheath hematoma is a condition in which there is an abnormal accumulation of blood outside the blood vessel. These severe symptoms of dengue start appearing 24 to 48 hours after you notice a high fever. So kapag ikaw ay nakakaranas ng abdominal pain, pwede mo ring ma-experience ang panlalambot or yung tinatawag nating tenderness. Second, persistent vomiting. Persistent vomiting is mentioned as a symptom of a large variety of systematic disorder. It is commonly used interchangeably with chronic, recurrent, or interactable vomiting and widely used as a warning sign of severe illness, dengue infection. So masasabing siya ay isang severe illness dahil very alarming yung tuloy-tuloy na pagsusuka within 24 hours. So if ever na nararanasan mo ito, pwede kang tumakbo agad sa pinakamalapit na health center or hospital for you to be treated. Tapos, the third one is hematemesis. So, yung hematemesis is the vomiting of blood, which may be obviously red or have an appearance similar to coffee grounds. So, magkakaroon ka lang ng hematemesis when your blood vessels become damaged and leaky and the number of clot-forming cells or yung platelets sa bloodstream ay babagsak. Pwede itong mag-lead into shock, internal bleeding, and organ failure, and even death. Fourth is epistaxis. Epistaxis refers to nasal bleeding of any cause. Most epistaxis is minor and insignificant, but it may be severe and life-threatening, and it can be indicative of more serious disease. So when you have a fourth day of dengue fever and you have nosebleeds, you need to see a doctor. do tests to get a specific diagnosis. If you still have questions about nosebleeds when you have a dengue fever, you can go to a hospital of Binmic Health System for further examination and advice. Melena. So, yung melena naman, ito yung black stool pag ikaw ay may dengue hemorrhagic fever. So, pagka may internal bleeding ka during the fever, it is possible na mag-result ito ng black vomit and stool. Ito rin ay pwedeng cause ng pagbagsak ng platelet count mo sa blood. 6. Yung edema. So, yung edema is swelling caused by too much fluid trapped in the body's tissue. Edema can affect any part of the body, but is more likely to show up in the legs and in the feet. So, yung 7 is lethargy, confusion, and restlessness. Pagkahilo, pagkabalisa, or pagkatuliro. Yung next naman is hepatomegaly and pleural effusion. So, yung hepatomegaly is enlargement of the liver beyond its normal size. Certain conditions such as infection, parasites, tumors, anemias, toxic states, storage diseases, heart failure, congenital heart disease, and metabolic disturbances may all cause an enlarged liver. Hepatomegaly is the most important clinical sign. Elevation of liver enzymes can occur with or without hepatomegaly. Significant rise of liver enzymes help in recognition of severe forms of dengue infection like DHF and DSS. So, yung pleural effusion naman is one of the complications of dengue fever resulting from the plasma leakage into the pleural cavity. Very little work has been done to determine the nature of pleural effusion in dengue fever. And yung last natin is marked change temperature. So, nagkakaroon ng changes sa body temperature dahil nga meron kang presence of fever. Normal lang naman ang ganitong symptoms, pero kung mataas na ito at hindi bumababa, kailangan mo na magpunta sa mga health centers for you to be get treated. So, for additional info po pala, meron po tayong 3 stages po na dengue hemorrhagic fever. The first one is the invasive stage. It usually occurs po during the first 4 days po ng DHF. So, the client may experience fever as the invasive stage abruptly happens. The common manifestations include high fever accompanied with abdominal pain and headache, which could be sometimes regarded as symptoms of common conditions. Sometimes, symptoms of flushing, vomiting, conjunctival infection, and epistaxis occur, but due to changes in viral infectivity, onset of these symptoms may vary. Yung second stage naman is yung toxic or hemorrhagic stage. It is occur po during the 4 to 7 days of the dengue hemorrhagic fever. It is a fever may subside, but the risk for bleeding tendencies for the client may however take place. Clinical manifestations may include severe abdominal pain, hematemesis, melena, unstable blood pressure with narrowing pulse pressure, and at times shock. Dengue may be fatal at this point. So, yung last stage naman, yung tinatawag natin convalescent or recovery stage. It is occurs po during the 7 to 10 days po ng dengue hemorrhagic fever. So, it is when generalized body status is regained and vital signs, especially the blood pressure of the client, is already stable.
According to the latest reports from health authorities, there has been a significant increase in the number of dengue fever cases in the Philippines from January 1st to February 18th. A total of 17,130 cases have been reported, which is more than double the number of cases reported during the same period last year. The region with the highest number of cases is the National Capital Region, which includes the city of Manila and surrounding areas. This region has reported 2,609 cases, followed by Central Luzon with 2,024 cases, Calabarzon with 1,704 cases, Northern Mindanao with 1,620 cases, and Davao with 1,603 cases.
Diagnosis: blood test and imaging test to diagnose dengue fever infection. Because the body immune response to the virus is complex and dynamic, the dengue infection is difficult to diagnose without laboratory and regional tests. Initially, symptoms may be the same as other diagnoses such as malaria. Complete blood count, CBC or CPV, to check the platelet count typically of the later stage of the illness and detect the decrease in hematocrit, hemoglobin, and red blood cells. RBC count, evidence of anemia. Would occur with blood loss associated with severe dengue fever. Dengue serology test to detect antibodies produced by immune system when a person has been exposed to the virus. These tests are most effective when performed at least 4 days after exposure in the primary and secondary infection. Dengue virus antigen detection. To confirm dengue viral infection, the test is useful to diagnose early dengue infection and can be conducted within 1 to 2 following dengue infection.
Mode of transmission. The dengue virus is spread through human to mosquito to human cycle of transmission. The dengue hemorrhagic fever is caused by Aedes aegypti mosquito. Aedes aegypti is a small, dark mosquito that can't be identified by white bands on its legs and silver-white pattern on scale on its body, and looks like an ancient Greek musical instrument called lyre. Human to mosquito transmission can occur 2 days before someone shows symptoms of illness and up to 2 days after the fever has resolved. Dengue is spread through a bite of female mosquito Aedes aegypti. The mosquito became infected when it takes the blood of a person infected with the virus. After about 1 week, the mosquito can then transmit the virus while biting a healthy person. So, ang alam natin, 'di ba, ang dengue is galing siya sa lamok. Pero totoo is galing siya sa tao. And pag yung lamok is kinagat niya yung tao na may dengue virus, is magkakaroon din siya noon ng dengue virus, at yung pag kumagat siya sa healthy person pag yung lamok kumagat siya sa healthy person, is matatransmit niya doon yung dengue virus. So ganun yung pagkalat ng dengue, or ganun yung mode of transmission ng dengue.
Types of treatment for dengue patients. There is no specific treatment for dengue fever that exists. Rather, the focus of treatment is curing the symptoms rather than the dengue itself. So instead, our group provided a management per classification of dengue that we found in the OH page. Management based from patient's type. 1. Group A. Patient may be sent home if they are able to tolerate adequate volume of oral fluids, pass urine every 6 hours, do not have any of the warning signs, particularly when the fever subsides, and they have stable hematocrit. Second, Group B. These are the patients who should be referred for in-hospital management. Patients shall be referred immediately to in-hospital management if they have the following conditions: patients with warning signs, patient without warning signs but with coexisting condition that may make dengue or its management complicated, such as pregnancy, infancy, old age, obesity, diabetes mellitus, hypertension, heart failure, renal failure, and chronic hemolytic disease, such as sickle cell disease and autoimmune disease. Next is social circumstances, such as living alone or living far from health facility or without a reliable means of transportation. Lastly, the referring facility has no capability to manage dengue with warning signs and severe dengue. 3. Group C. These are the patients with severe dengue. They require emergency treatment and urgent referral. These are the patients with severe dengue who require emergency treatment and urgent referral because they are in critical phase of the disease and may have the following: severe plasma leakage leading to dengue shock, or fluid accumulation with respiratory distress, severe hemorrhages, severe organ impairments such as hepatic damage, renal impairment, cardiomyopathy, encephalopathy, or encephalitis. Lastly, patient in Group C shall be remain hospitalized within 24 hours.
Dengue prevention and control programs in the Philippines typically involve a multi-faceted approach. Here are some key strategies and measures that have been used. First, public awareness and education. Educating the people about dengue transmission, symptoms, and prevention is a fundamental component. This includes media campaigns, school programs, and community outreach. Vector control. Aedes mosquitoes are the primary vectors for dengue. Vector control measures involve reducing mosquito breeding sites through proper waste disposal, removing stagnant water, and using larvicides or insecticides. Third, fogging and spraying. In areas with dengue outbreaks, fogging and indoor residual spraying may be conducted to kill adult mosquitoes. However, these are often considered as a short-term solution. Fourth, community participation. Engaging communities in the elimination of breeding sites and the use of protective measures like mosquito nets and long-sleeve clothing and insect repellent. Fifth, early detection and healthcare. Improving healthcare infrastructure to provide timely diagnosis and treatment for dengue cases, especially severe cases, is crucial. 6. Surveillance and reporting. Monitoring and reporting dengue cases to detect outbreaks early and respond effectively. 7. Vaccine implementation. In some cases, dengue vaccines have been introduced as part of the prevention strategy. 8. Research and innovation. Ongoing research into dengue prevention and control methods including the development of new tools and technologies. It is important to note that the specific strategies and programs may evolve over time based on the dengue situation in the Philippines and the effectiveness of various measures. Always refer to the latest guidelines and information from the Philippine Department of Health or relevant health authorities for the most up-to-date information on dengue prevention and control.
We have here a amazing fact about dengue hemorrhagic fever. So the first one is a single person can be infected with dengue fever more than once. If a person has a medical records of dengue fever before and is once again infected, then there is more risk of developing serious and life-threatening dengue hemorrhagic fever. So, it is possible for an individual to contract dengue fever multiple times. If someone has history of dengue fever and gets infected again, there is a higher risk of developing severe and potentially life-threatening dengue hemorrhagic fever. The second fact is as per medical records, symptoms of dengue fever usually differ from infants to children and also from those who have been infected for the first time. The symptoms of dengue fever can vary between infants, children, and individuals experiencing their first infection. And the third fact is fatigue and headache followed by continuous vomiting, rashes on the skin, high fever, drop in blood pressure, pain and body aches are some of the cause symptoms of patients suffering from dengue viral fever. So, common symptoms of person with dengue viral fever include fatigue, headaches, continuous vomiting, skin rashes, high fever, and a drop in blood pressure, and body aches. And the fourth fact is the presence of the dengue virus is usually diagnosed through the antigen test and antibody test. The low blood cells counts can also detect the presence of dengue fever in an individual. Dengue virus presence is typically diagnosed through antigen and antibodies test. A low blood cells count can also indicate the presence of dengue fever in an individual. So the fifth is similar to other viral infections. Dengue fever also can cause life-threatening complications if left untreated. So, similar to other viral infection, untreated dengue can lead to life-threatening complications, including pneumonia and heart swelling. The sixth is the only mode of transmission of the dengue fever is an incubation period for this viral infection. Ranges between 4 and 14 days after being bitten by the infected mosquitoes. So the dengue fever is transmitted exclusively through the bite of Aedes aegypti mosquitoes. The incubation period for this viral infection ranges from 4 to 14 days after being bitten by infected mosquitoes.